Senior Vice President and Chief Operating Officer of Grandview Health. It's been my privilege to work at Grandview for over 23 years and have been part of the Pennridge community for almost 23 years. We moved here in April of '99. So my family, we sent 3 kids through the Pennridge School District. Scott took most of them out of the principal's office for me, and I really do appreciate that as well. I had 2 student athletes, a softball player and a baseball player that won the district title in 2016. I always give a shout out to that. I also mentioned to Dr. Bolton, I walk in, I see these practice nets here, I get cold chills because he had practice at 5 a.m. every day. He was probably just going to bed at 4:30 from studying, and he never got here on time, I don't think. So, but it's always great to be here. And I'm also a recovering Little League and travel basketball coach, so I've had a little bit of experience in that as well. But through sports in this community, I've made many good friends and got to know many families. And that really is a great way, if you're new to this community, to get connected. And we really did that through sports. I also want to recognize Dr. Widener is here tonight. So Paul, it's nice to see you as well. Thanks for being here, part of our orthopedic group. So it's my privilege to introduce Dr. Dale Bautista, a sports medicine physician at Grandview Health. Dr. Bautista grew up in Philadelphia and attended Temple University for his undergraduate studies. Started his professional career in genetics research. He also attended medical school at the American University of the Caribbean and later returned for his residency training at Einstein Montgomery Hospital in Norristown. He completed his fellowship, specialty training in sports medicine at St. Luke's Hospital in Bethlehem and remained in the Lehigh Valley for the first decade of his career. He spent over a decade as team physician for NCAA Division I sports. Dr. Bautista also founded a sports medicine specialty fellowship training program in affiliation with Temple University, for which he remained director of sports medicine for the duration of its existence, training other young physicians to become sports medicine experts. He now continues his vocation of sports medicine, treating the active patient in Montgomery and Bucks County with his colleagues at Upper Bucks Orthopedics at Grandview Health. Dr. Bautista maintains an interest in endurance athletics and outdoor sports, as well as chronic tendinosis and the recreational athlete. I think he's talking to me. He believes that motion and fitness are the key to longevity and decreasing health risk, and that a large part of his role in treating patients is first educating the patients on the dynamic or on the mechanics of injury processes. When he is not taking care of patients, he likes to spend his free time on his mountain bike or trail running with his wife and daughter. Please join me in welcoming Dr. Bautista to the podium tonight.
All right. Good evening, everyone. Thanks, Mark, for that introduction. So thank you, everybody, for having me today. We're good. You guys everyone can hear me out there in the back. I'm excited, a little bit nervous. So just kind of pardon my enthusiasm. I haven't done this in almost 2 years now. I haven't spoken in front of an audience, and so I'm excited that everyone showed up tonight, and I'd like to thank everybody for this entire setup. It looks great. So I'm here to talk about health and wellness through movement, the effects of the current pandemic on our physical well-being. So objectives of this talk, it's first I'll go over fitness from a medical aspect. We physicians use this term fitness, medically fit, and a lot of people don't really know what medically fit is. If you're generally medically fit, you tend to be overall more healthy than the person who's not medically fit. So we'll go over some of that. Fitness in relation to acute and chronic illnesses, the initial effects of fitness and subsequently overall health during this pandemic, and the aftermath of the pandemic. Hopefully that's in our sights pretty soon, and then moving forward into the future. So what is medically, physically fit? The medical society, we doctors say it's about 150 minutes per week of moderate physical activity. So just from a show of hands, can I see how many of you consider yourselves regular exercisers? So that's pretty good. And then how many of you guys would you say exercise at least 2 hours per week? Okay, so that's pretty good. Chances are you're probably in that medically fit category. And when I describe medically fit, you might actually be surprised at how easy it is to be medically fit compared to someone who's not necessarily medically fit. And being medically fit is, it has benefits like joint motion preservation, muscle mass preservation, a boosted immune system, which is important in this time, and of course psychological benefit, as our friends at Penn Foundation can attest to. So 150 minutes per week of moderate physical activity. That's 2 hours. It can be 20 minutes every day. It can be an hour twice a week. It can be 2 hours on one day of the week. It doesn't necessarily matter as long as you get that 150 minutes of moderate physical activity per week. And that can boost your overall health and fitness, or health and fitness, that's correct. So what are levels of fitness activity? There's 3. There's light, moderate, and vigorous. So light physical activity is basically sedentary. Slow walking, cooking, playing most instruments, fishing, things that don't require much effort, basically sedentary. You can do a lot of these things sitting down. That's your light levels of fitness activity. Then there's moderate, which is a little bit more. It's brisk walking, doing heavy house chores like mopping, or doing all the windows of the house, moving furniture, playing badminton or pickleball, which is rapidly gaining popularity in our state here. And then there's vigorous. Vigorous tends to be the organized sports that we think of: jogging, hiking, organized sports, going to the gym and lifting for an hour. That's vigorous. So in the medical community, fitness, a medically fit individual really just does fall in this moderate level of fitness activity, this moderate category. And I think almost all of us can probably achieve this with not much effort. If you're a light level of fitness activity person, you probably run the risk of more morbidity, more risk for illness and earlier death. If you're more of a vigorous type active person, you're almost always benefiting from it, but there are sometimes the people who are overreaching and overtraining, which is probably a topic for another talk, those can actually affect your immune system in negative ways. So there's some static in the literature that the very elite or vigorous athletes don't always necessarily have more healthier lives. So fitness and medical health. So being fit benefits virtually every organ system in the body. In relation to illness, your internal organs, we've known throughout the years, it lowers your risk of heart disease, stroke, type 2 diabetes, high blood pressure, dementia and Alzheimer's, several types of cancer, and some complications of pregnancy. In relation to your sleep health, you get better sleep when you exercise regularly. You get improvements in insomnia and obstructive sleep apnea. When I get patients who decide to start a regular fitness routine, they tend to come back and report that they're experiencing more vivid dreams. Vivid dreams are usually a sign that you're getting better rest. In relation to your neurologic system, people who tend to exercise regularly have improved cognition, including memory, attention, and processing speed. As they get on in their senior years, their memory degradation is less. In relation to obesity, there's less weight gain, less obesity-related chronic health conditions, and improved metabolism. And in regards to your musculoskeletal system, you have better bone health and balance with less risk of injury from falls, less chance for osteoporosis by doing impact-type exercises. You keep your bones strong and you can avoid that osteoporosis risk, that softening of your bones. And then in regards to mental health, as our mental health colleagues here can attest to, people who have regular exercise activities or regular fitness activities almost always suffer from fewer symptoms of depression and anxiety, better quality of life, and sense of overall well-being. So in relation to pretty much all organ systems, all causes of what we call morbidity and mortality, illness and death, having a regular exercise routine improves all of these by a large percentage. So in sum, you really have to stay active, stay fit, and stay alive. Again, moderate physical activity really isn't that, it isn't what you think it is generally. It's the person who really just gets his heart rate up for 2 hours a week. Most of you can achieve this, what we call medically fit. And I usually ask people, is it worth 2 hours a week of your time to prolong your life 15 to 20 years, or to live with an illness for 15 or 20 more years? And of course it is. You know, you get up for work to work 8 hours a day to put food on the table. Add that 2 hours to benefit your life so that you can continue to work to put food on your table. Enter the COVID-19 pandemic. So we've known for generations, yeah, you know, if you're fit, you're healthier. And then comes this pandemic, which is trying to kill us, and it's hampering our abilities to get out and be fit. So first it was stay-at-home orders, then it was closure of businesses. I don't know about all of you others, but when I want to do something, I have to go somewhere to do it. If I want to exercise, I have to go to a gym. If I want to read, I have to go to a library. If I have to sing, I go to a karaoke bar. So when the pandemic hit and businesses were closed and my gym was closed, I was at a loss. It was difficult. And then what made it worse is we had mask mandates, which again make it difficult to do physical activity. And then employment and school changes. This was probably the hardest challenge for a lot of us, is just trying to teach your children at home for virtual class, as well as trying to do things at home. How many of you have had to go to work at home since this pandemic? Any of you? Okay. And does it look as though a lot of you, moving forward, will probably do a lot more remote work? A lot of you? Okay. So that's going to present some challenges in the future, again, with trying to stay fit. And then here we are with prolonged social distancing. We're 2 years into this, and we still have masks, and we still have social distancing rules, and my favorite restaurants are still closed, and who knows if they're going to open. And I hope you all have your toilet paper at this point. My grocery store still has a limit. Okay, just as an aside, social distancing versus physical distancing, the terminology, I find it a little odd, and I think social distancing, I think the true term is really physical distancing, because the way that we're preventing disease is, 6 feet apart, physical distancing, and social distancing is really just a result of physical distancing. So it's a consequence more so than something that we're trying to do. And thankfully, with the use of technology, virtual experiences, we can still maintain our social relationships and still physically distance. So when I prepared for this talk, I decided, well, what really are the impacting factors that will impact the way that we perceive fitness moving forward? We're 2 years into this, so naturally I'm turning into the medical journals to see, is there any real data that this COVID-19 pandemic has really kind of hampered our abilities to stay healthy? And so early on, this is just pulled from different journals that I've researched before preparing for this. So the initial public health recommendations to prevent COVID-19 spread have the potential to reduce daily physical activity. We kind of knew this already. Declines in fitness appear greater among children who participate in organized team sports and those with limited space and opportunity for habitual exercise at home or in their neighborhoods. So the ones that were really vulnerable were the school-age children who had participated in organized sports. They were the first to kind of shut down. They were the last to get vaccines. And at this point now, they really are still sort of suffering from not achieving the same amount of fitness that they had pre-pandemic. Short-term changes in physical activity and sedentary behavior in reaction to COVID-19 may become permanently entrenched, leading to increased risk of obesity, diabetes, and cardiovascular disease in children. Studies of the general public revealed lower psychological well-being and higher scores of anxiety and depression compared to before COVID-19. And I'm sure our mental health professionals that are here tonight can attest to this. And then here we are, working age individuals, patients above 50 in North America who had COVID-19 and did not require hospitalization, showed a decline in mobility and day-to-day function as far as 9 months after illness. And these are generally healthy individuals, middle-aged, who got the illness, nursed themselves back to health without requiring hospitalization, and returned back to their previous state of health, but they continued to report a decline in sort of mobility and day-to-day function as far as 9 months after being ill. That's a pretty significant amount of time. And people who participated at higher levels of sports pre-pandemic, not necessarily professional sports, but the more elite levels of athletes pre-pandemic, suffered the greatest percentage in reduction in participation in sports currently. And so, you know, the list goes on and on. There is an effect with overall fitness and what the pandemic has done with influencing that fitness. Just as an example, I had a gentleman, we'll call him Jerry, just for privacy's sake. The summer of 2020, late summer, his son brings him into my office, and for a complaint of low back and thigh pain in both of his legs. Jerry is a retired laborer. He was a heavy physical laborer for 40 years. He was 92 years old. He lived independently in his own home in Philadelphia. He was in a row house in Northeast Philadelphia. He mowed his own lawn every week. Every day he walked to get the newspaper down to the corner. Generally a healthy guy without any chronic illnesses. In April of 2020, we went on shutdown, and his son, being the good Samaritan that his son was, took him in his home in Lansdale to help protect him from the virus. And during the stay-at-home orders, he basically stayed inside as a shut-in. He didn't get outside much. He lost his daily routine. He watched a lot of TV and basically did not much else in that. His son basically did everything, got his food for him, kept him inside, didn't let him do anything. And they show up into my office, and so I do a complete exam of this gentleman, and the gentleman's completely wasted. You know, he's got wasting in his face, all of his muscles are gone. He can barely walk 3 or 4 feet before his legs hurt and his back hurt. And I tell this gentleman, I really don't think this is your bones or your joints here. I think this is something called failure to thrive. And so for you non-medical folk, failure to thrive is when a human body or a person, whether it be a child or an adult, really is just not sustaining enough nutrition to keep the body alive. So this gentleman was wasting away basically from the social effects, the not having a schedule, the emotional effects of this pandemic. And he didn't even get COVID-19. He was just shut in for 3 months. So this is a guy who didn't do anything. Well, it wasn't because he was lazy, it was because his son was trying to protect him. And here he is, failure to thrive after just 3 months. So this is sort of an extreme case, but again, fitness comes into play here, a balance of a daily schedule, mental health, and staying overall medically fit is what kept this gentleman alive for 92 years. And it only took him 3 months to try to actively die on us. Anyway, I did get a hold of his primary physician in Philadelphia. We got him plugged into a bunch of specialists, including mental health specialists and nutrition. And I've lost touch since then, but he was on his road to recovery. So just, again, an extreme example of what the pandemic can do, even if you don't get the illness. Thankfully, a lot of us have adapted. There's a good percentage of the population who are generally fit, again, medically fit, who despite initial drop in fitness with the stay-at-home orders, quickly learned to adapt and return to a similar level of exercise despite stay-at-home and social distancing orders throughout the 2 years. And I believe as a community, we need to return to our previous levels of health and fitness to maintain overall health, to maintain our generation. And we need to recognize the challenges to obtaining this goal. So where are we today? Well, when I first got invited to participate in this, I was anticipating a talk where none of us would have masks and we'd sort of be kind of over this. But I think, I think we all kind of know with the status of, how our hospitals are in the surrounding counties that we're still very much in the thick of the pandemic. So not so much an aftermath, but today we're sort of in the during math of pandemic. Social and physical distancing rules are a little bit more relaxed now, and a lot of us are a lot more used to it. There's vaccinations and things like that. But the pandemic still very much has us on lockdown in many ways, and probably for a long, long time. Simply from a display of the people who are now working from home and probably will work from home for a long time. Again, our school-age children are among the highest risk, the most vulnerable for losing fitness. Again, the reduction of indoor and organized sports, lack of vaccines until just recently. I often hear from parents who have children who are really just afraid to play outside anymore. And it's a sad sort of state that we are in when our children are afraid to go outside. And then again, with the rapid advancement of virtual at work and meeting technology, our desk professionals have stayed at home and are likely to stay that way for the long term. That's another population that's very vulnerable. We used to say the average working American would take about 3,000 steps a day. And if you lived in Manhattan, it was probably about 5,000 steps a day. Well, people who are working at home now, that's pretty much zero. The routines of getting to work have changed. No longer are you out there scraping ice off your windshield or catching a train or running from the train to your office. You're rolling out of bed and you're going into your home workstation to get to work. Ergonomics have worsened. I myself, I don't feel I have a good ergonomic workstation in my house. Dietary habits have changed now that we have access to our home kitchens. If we have a home office, we're at risk of sort of losing a good nutritional balance. And our exercise routines have changed. Some of us really haven't had our gyms reopen, or we haven't really figured out what to do since pandemic. And then also there's mental health. The social aspect of all of this, really nothing does compare to interpersonal relationships and live visits with your colleagues and your friends and family. So what are our realities? So some of the realities for fitness are really just more and more of our fitness routines will be conducted in the home. Direct-to-consumer products have replaced brick-and-mortar businesses. How many of you know at least one person that's bought a Peloton in the last 2 years? Yeah, okay. Thankfully, group classes have proven successes. Again, Peloton and Nordic Track, iFit. They've got really proven success on virtual platforms. People have stopped paying for brick-and-mortar gym memberships, and they're throwing their money at Peloton and Nordic Track for the better, and they get really good experiences out of it, and I think that's great. Anyone remember this guy? Richard Simmons, sweating to the oldies. So how do we avoid inactivity and reduce fitness moving forward? As this pandemic continues and or subsides, we should continue to stay active, right? So outside activities above and beyond have always been safe. Whether there's a pandemic or not, outside activities, very, very low risk that you'll get sick. Pennsylvania is a beautiful state, whether you appreciate it or not. One of the reasons I'm still here in Pennsylvania is just the Four Seasons are amazing. I'm a mountain biker. My family are trail people, so be outside. Again, that 2 hours of moderate intensity physical activity, you can achieve that with a 2-hour hike once a week. You can achieve that by splitting wood. You can achieve that by walking your dog briskly for 20 minutes a day. Home office modifications. For those of you who don't really see a future of going back to a brick and mortar office, at least twice a month, I have a patient who walks in with neck and back pain. And these are 20 and 30-year-old working, young, most of them men for some reason, with neck and or back pain. They are systems analysts, IT professionals, and and they're working from home. And basically what I do when I take their history is I ask them, what does their workstation look like? And undoubtedly, a lot of these young 20 and 30-year-olds roll out of bed and onto their sofa and start working, and they'll sit for 6 hours, make something for lunch, and sit for another 6 hours, and then go back to bed, and that's their entire day. And a lot of times I'll treat them with medication. I'll give them some home exercises to help loosen their back and neck, and I'll tell them to go turn their desk into a standing workstation. 2 weeks later, they'll almost always call me and say, that thing, I can't stand for more than 20 minutes. And all I have to do is say, you're telling me you can't stand for more than 20 minutes? And they say yes. And I say, well, keep at it, keep doing your exercises, and see me in a month. 6 weeks later, almost all of them say their neck is better, they're more productive, they stand up at work, they can't stand sitting down because it hurts when they sit down now. And a lot of them are like, well, now I want a treadmill underneath so I can get my 2 hours of moderate physical activity while I'm working. So just think about that in the long term when you know you're not going to be reporting to an office anymore. Just think of Jerry, the 92-year-old who sat for 3 months. It doesn't take long. If you've been working from home for 2 years, you've probably lost some fitness there. And then again, indoor interactive exercises activities has exploded. Again, the Peloton, the Lululemon Mirror, Nordic Track Fit, iFit, home gyms, virtual classes. Most of our fitness centers have now reopened. Shout out to the Y here of Bucks County now. Feel free to talk to them about their programs. So in addition to fitness, you have to, certainly the balance of life is overall fitness in addition to exercise. Nutrition. Access to food has now changed with the pandemic. Food is now direct-to-consumer groceries. You don't have to leave anymore. You hit a couple buttons on your phone, you get your groceries, you get your takeout food. A lot of that has influenced our fitness as well. You're going to want to take inventory of that. Take an active role in reassessing your kitchen and your meals, especially those, again, who are now working from home. Whether you're meeting your fitness goals or falling short, match your food intake with your activity levels. Meet with our colleagues from Giant and Weiss for your nutritional educational needs. If you're not that active, maybe you don't need so many calories. If you're very active, maybe you need more. They'll be happy to talk to you about that. As far as our mental health, again, our colleagues at Abby's Bakery and Penn Foundation and NAMI of Bucks County, Friends Hospital, and our suicide task force at Bucks County. I encourage you, I implore of all of you, maintain your personal relationships. If you have relationships with mental health specialists, maintain that appointment with your therapist twice a month or once a week or whatever it is. If you meditate, if you go to church, go back to church. Do it in a safe manner. Mental health is just as important as cardiovascular and physical and musculoskeletal health. I guess that's it. Be kind and care, everybody. I say care. There's an acronym for CARE. It's create a remarkable experience. And basically, when you care, that's what you do. You're all here because you care about something. You care about, whether you care about fitness, whether you care about the community itself, whether you care about someone else who's here, or if you just want to hear some doctor talk about fitness, you care. So continue to care about something. That's really sort of what we're here to do. And as long as you care about something, chances are you're guiding yourself in the right direction, in the right vocation. So I'm not really the main event to this. So all of you guys are here. You've set up this beautiful thing where we can learn, these workstations where we can kind of learn from everyone else's expertise. So I'd like to give special thanks to the Pennridge Community Partnership and Lisa for putting this all together. Our friends over at Giant and Weiss, again, feel free to come talk to them about your nutritional needs. Bucks County YMCA, talk to them about their exercise programs. and our mental health professionals, Penn Foundation, Friends Hospital, NAMI of Bucks County, Abby's Bakery, and Suicide Prevention Task Force. Again, mental health, it's gotten a lot of recognition lately, especially in the pandemic. Feel free to talk to these guys. They are excellent mental health professionals here. So that's all I have to say. Thanks for coming out. And again. Oh, sorry. Our Grandview hosts. We also have 3 stations here to help promote fitness. One is, I spoke a lot about ergonomics in the workplace. We have an ergonomic workstation. So excellent workstation. You can check out how you can set up your workspace at home or even in your office to accommodate good posture and good health and good core strength. We've got a station on e-fitness and home stretching and strengthening techniques. So again, like I said, I'm not really the main event here. It's really just, again, getting back out into the community, getting out to live things where we can kind of participate and again, interact with the community again. So again, thanks for having me, guys. And I'm not sure if he's here yet. Dr. Michael Herrera? Okay. So yeah, again, another person I'm glad to have here. He's here if you want to learn about his exercise science program that's starting for high school level next academic year. All right. Any questions, anyone? Again, thanks for coming out.